I would love to take a little bit of time. We talked about the devastation that polio caused, even in recent memories in some of our lives, our families' lives. We don't know much, at least I don't personally, about rubella, mumps, measles. So Stephen, you treated rubella and mumps in the past, actually. Do you mind explaining in simplest terms what does rubella do during pregnancy, and why is the timing of infection really dangerous? How does it cause then congenital rubella syndrome? What does that look like?
Well, I think you're bringing up the fact that when you oppose measles vaccination, you forget that it's the MMR vaccine, measles, mumps, and rubella. Rubella doesn't leave the person who has it sick at all, or maybe they might notice not feeling so well with a mild fever. But if you are a woman in the first trimester of pregnancy, your child will be damaged. What exactly is damaged is dependent on when in that first trimester you had the virus running through your bloodstream. And we would see large number of kids who were born deaf, who were born blind, who had major cardiac abnormalities on a not uncommon basis. And that went away when we started using MMR. Mumps, uh, everyone knows about the swollen jaw, but also causes the gonads to swell. For a woman, not a big problem. Your ovary is designed to swell, does it every month. But for men, it's not designed to swell. And if you were involuntarily sterile in the 1950s or 60s, you by definition had mumps as a child. And it was the largest cause of male sterility that was commonly looked at. And I think it emphasizes that the illnesses that we see don't see anymore, that the pediatricians aren't trained in. I saw a kid with chickenpox who had encephalitis from chickenpox. There's no treatment for it. And the parents grew up not as fearful as our parents did because of polio vaccine, but they grew up scared of a lot of vaccines. And you could see the relief when a meningitis vaccine came out, when a rotavirus vaccine came out. The parents embraced them. Uh, there was almost no fear, and they were just relieved to have something to take one more fear of raising a child off their head,
That's right.
off
We
their
have
mind.
enough to worry about. And we always say
I
vaccine.
can't hear you.
Oh, I just nodding in agreement, Dr. Luber, that parents have enough to worry about. And so not losing your children or having your children be ill due to these infections is one of the greatest achievements of humanity, I would argue. So thank you for that. I also remember, Vivian, you talked about the Ebola outbreak that you were involved in when you were giving your introduction. But you had said you encountered measles during the Ebola outbreak, and it was, I believe it was you who were one of the few to identify it. Do you mind giving a bit more color on that story and then what measles actually does to your immune system and why it's so dangerous?
Yeah, absolutely. So back in 2015, I went with Partners in Health to respond to the Ebola outbreak in West Africa. And as many of you may remember, this outbreak made world news, and everybody learned about it. And globally, many public health experts and physicians came to respond. So I came to Sierra Leone thinking I was mainly going to be responding to Ebola, but what happened was because there was such an emergency with Ebola, and that all health systems basically had to respond to this devastating disease, that a lot of other health programs couldn't actually run as normal. So, for example, many of the physicians from the medical schools were pulled to work on Ebola response. All the nurses, all the health care providers in the country all had to be pulled to respond to Ebola. And as a consequence of that, routine immunization programs had to stop. There was nobody running those routine immunization programs. There were no clinics open. And as a result of that, while we were all responding to Ebola, we started to see babies with rashes, and we weren't sure what was going on, but because schools were closed, clinics were closed, nobody was really getting any routine medical care. Our team started to have suspicion for measles. And I remember going out with a team of WHO doctors and myself with Partners in Health. And I saw a baby and I thought, this is probably measles. There is there is a medical term called Koplik spot, which is like a blue ring that you can see sometimes. That's in the buccal or in the mouth of the baby, and I was able to see that, and I thought this has got to be measles. And what we did, which was really fantastic, is that the Dutch government had sent a lab to the Ebola response, and they were working out of containers, basically, right? One of those containers, and they were initially only testing for Ebola, but because I had developed a friendship with the Dutch physician, I said, I think this is measles. And she's like, I think so too. And I said, would you be willing to swab the baby and check to see if it's measles? And ultimately we found measles. So when you have one devastating disease compounded by another illness, it really speaks to really how important vaccinations are. Now, I'll say at the time that when I was in Sierra Leone, an Ebola vaccine was not available, but because of that outbreak, studies were able to be carried out in that setting. And so we now also have Ebola vaccine, 100% vaccine efficacy against Ebola. But I think the importance here is that while we did find measles, I would say that, not all measles is benign. I think a lot of people commonly feel like, oh, it's just, a rash, and maybe the baby might have some upper respiratory, kind of symptoms like a mild cold. But that's not entirely the case. There are a couple of complications that can happen that people may not be as aware of, and one being subsclerosing panencephalitis, which is a rare outcome of measles, but does lead to mortality. So it can actually come on 7 to 10 years after someone has been infected with measles, and then they die from encephalitis. So it's a rare condition, but why put your child in harm's way and having that uncertainty that they may actually die of something very rare? Can you imagine being a mother and having a child pass because of an encephalitis, something from, a while ago from a measles infection? So that's one thing I wanted to highlight. But the second thing is that we're also learning too from some of the researchers that work on measles is that when you do get infected with measles, it seems to wipe out your immune cells and your immune memory and the ability to actually fight other infections. Now, initially, they thought this was very short-lived, for a couple of weeks, but more research is being done, and it seems that this type of immune amnesia, as they call it, seems to last for 2 to 3 years. And so there's a researcher by the name of Michael Mina who's out of Harvard, and he's been doing some of this research. And it seems like the measles virus likes to latch onto the memory cells, our immune memory cells, and just wipes out our ability to have a normal immune system for our children. So I think with those two complications, which isn't often talked about, I think it's not to put fear into people, but there are serious consequences of getting these infections. Why get an infection when there is a vaccine that's available to prevent it? So I think, by telling the story of, my time in West Africa responding to Ebola, at the same time finding measles, and then with also these medical sequelae and complications later, long term, I think there's a lot of value to vaccinations and a lot of value to prevention. So just really wanted to share my experience and also just some of the medical pieces of this that aren't always talked about. So yeah, thank you.
Thank you.
Vivian, just want to clarify. The sclerosing encephalitis comes on years later, but kids with measles can die acutely because we've had a couple of deaths in Texas in the current large outbreak of 600 people. So it's not only the risk of death long term, it can happen acutely as well, right?
Absolutely, absolutely.
Okay.
Yes, absolutely. We've already had two pediatric deaths and actually one adult death in this current measles outbreak that has exploded to over 700 plus cases in 25 states. Absolutely, Michael.
You have to view that, remembering that in 2000, measles was considered eradicated in the continental United States. I once got called to look at a group in central Washington who had measles, and I was the expert because I'd seen one case. And I had him, of course, I had him myself growing up, and I remember being quite sick with it. And people were scared of the encephalitis because they kept us in dark rooms and we couldn't listen to music or watch TV while we were ill because they were afraid this would stimulate the deafness or blindness. It was not true, but that's what was common knowledge at that time. So measles is not trivial, and as you know, the most infectious of all the illnesses that we run into. Each person will generally infect 19 others, and doesn't require a whole lot of contact around them or even on surfaces to get measles. So you are dependent on the herd immunity to
Yeah.
control measles.
And
Just to
before,
echo what you were talking about, there have been two developments in our history which have increased the health of the citizens of any country. One is clean water, the other is vaccinations. Everything else is ancillary.
Yeah.
and before the development of the measles vaccine in the early 60s, in the US, there'd be 400,000 to 500,000 cases of measles every year. And now
Mhm.
it's down to 2000 was zero and it's bounced around, except years like this year when we're heading towards several thousands again because of lack of immunization.
It will be endemic.
Yeah. We've already had new outbreaks in several other states besides Texas and New Mexico that are not
Mhm.
tied to Texas. Anyhow, let's move on, Sia. Sorry.
Yeah, no, I mean it's sobering and fear-inducing and just listening to it's like two steps forward and then you take steps back,